Good morning. I'm Joe Flick with the Montana State Library, and I'm here with Renee, who's from the Missoula Office of the Aging, and she's going to walk us through a new program that her office is kind of heading up statewide, and something that librarians across our state and libraries can participate in. So, Renee, I'll let you go.
Thank you, Joanne, and hi, everyone. I appreciate you giving me this time. I'm going to talk about our program to give everyone an idea of what it is we're doing in the state, and then specifically talk about something that I'm hoping the libraries across the state would be interested in kind of partnering with our program. So SMP, it's one of those acronyms that is a name. It used to be considered Senior Medicare Patrol, but they wanted to kind of change our name because nobody's on patrol, and they have expanded it to being health care, not just Medicare, although the funding is through money from CMS, which is the Center for Medicare and Medicaid Services. So today I'm just going to kind of go through the program. It is national. We're in all 50 states plus the protectorates. I tried to put in a transfer to Guam, but it won't go through. But we're housed in different facilities across the nation as well. Here in Montana, apparently at the time in 1999 when it was going to go nationwide, nobody was interested in it, so we put in for the grant, and we've been running it ever since. Some states have it at their office or their commissioner for securities and insurance or attorney generals, and then quite a few state agencies on aging. We do partner in Montana with all of the area agencies, so each library that is in the various counties across Montana will have a closest office on aging in your area, and those partners are contracted to provide the SMP program in their area. And part of the reason for that is to have that local voice, when we're trying to talk to beneficiaries, have a local trusted community partner there, where as opposed to me, driving around and trying to reach everyone across the state. It works really well. We also had an advisory council that I rely on for not just ideas on how to partner, but they keep us updated on fraud trends and how we can better work in Montana with a lot of other partners informally. So that's kind of that. And then if we get into what our mission is, it's the same as our tagline. We want to empower seniors to prevent healthcare fraud, waste, and abuse. And if we can reach the people to make them understand why and how easy it is to do, that's our job. That's it. So we go around doing presentations and working one-on-one with folks. I always say we're like the third piece of a puzzle. The Office of Inspector General is who really investigates the fraud. Again, we're not on patrol. We research is what we do. The Department of Justice prosecutes, and then we're that third piece to try and educate people to stop it from before it ever happens. I do that by giving stories when I present, where doctors bill every day but Christmas for 3 years, and it's not until he's at $1.9 million that, Medicare fines him. And then we spend money investigating, we spend money prosecuting, and then, the money that is there to get back is not the full $1.9 million. So we try to get people to stop it when, all of those people who were getting Medicare statements could have stopped it when it was probably $100. There was one fellow he saw one time, and he got $102,000 out of Medicare for, and that could have been stopped with the fellow who got the MSN. Everybody gets a Medicare statement quarterly from Medicare if they've received services in that time period, and if they just look at them, that can stop all of this. And that's what we're trying to get to people, is to just open them up and check it over. Let's see here. I wanted to also Whoops. Why is it not working here? Oh, I see. I've got my slide set up. That's why, with some bells and whistles. Um, so Medicare fraud and abuse. I do like to point out that the EPA, our Environmental Protection Agency, costs us $3 billion to operate. Medicare fraud costs us $60 billion annually. That was in 2017. So $60 billion, that's all of our money being wasted. And, you know, when people talk about solvency of Medicare, if we could stop the waste, fraud, and abuse, Medicare would be solvent forever. Um, if I also try to hit home with people, you know, when I'm telling them about the fraud and abuse and how to stop it, you know, somebody thinks, oh, what's my one visit going to do? It's a drop in the bucket. But there was a woman who questioned $9.19. It was a duplicate charge on her MSN in Iowa. It returned $1.37 million back to Medicare because it was also on everybody else's bill that year. So that's what we're talking about. And that's why I'm hoping with the libraries, we're reaching some new people that we haven't reached. Working in the area agency network on aging and the senior centers, and, you know, we seem to do a really good job of reaching seniors that way, but we have not tapped into, we're probably missing out on 90% of beneficiaries who aren't accessing the places that we go. And so we want to get this message out to more people, and that's where we're coming to you. We do rely on volunteers to help with our program, and also team members, which are staff across the state in the area agencies and the county councils on aging. And we have, when people come in and they have billing questions, we do one-on-one work with them. And then, you know, where we sit down and go over everything. Sometimes we take cases where, you know, folks need help clearing up billing errors, or we haven't found huge swaths of fraud, of course. We're a low fraud state, and I expect that anyway. But hopefully what we're teaching people, then they go on and ask the questions and get things cleared up on their own as well. And then we do provide presentations. We go to health fairs and man tables and put out our information. Oh, and I built in my own applause because I wasn't sure if, you know, anybody else would appreciate it. No, but thanks for your time in understanding first the overall program. You know, the big picture and the value of SMP in fraud prevention. I am now going to, let me end this slideshow and show you what I'm hoping we can partner up with. Hold on here, I've got my picture, there we go. So this is the Medicare summary notice. We created a hardboard. It stands about 2 feet tall, and these pieces on here, you'll see, like, this is not a bill, the green one up at top. They all are just held in place with little magnets. So if you see in the middle on the left side, that's where I've pulled one off, so you could see that what they do is they pull off each color block, and below it, it will explain what, it will explain, let me pull this over here. Sorry,
Well, these are like little interactive displays. I was telling the libraries that they can get these
yes.
to put up in their library and let people kind of explore them on their own, right?
Yes, that's exactly. We're hoping that people will just play with them, and this is basically what it says below each one, and it tells people why they need to know this information, what specifically we want them to know about it. So at the end of the day, everyone feels more comfortable with these Medicare summary notices. Like I said, they get them quarterly, but a high percentage of people never open them. I think people in general feel that if, you know, Medicare's paid for it, it must be okay. And I've got this here that they process over 4.5 million to 5 million claims a day. I mean, Medicare is not the one that's going to know if somebody went to a doctor or not. As long as it's, T's are crossed, I's are dotted, it's filled out correctly, they're going to process it. So we try to really hit home that the person receiving this is that first line of defense that can stop it. And what we're hoping is we can get these hardboards in libraries and set them up, and we also have a brochure, or very coincidentally, we have bookmarks this year. So I'm hoping, and all the partners have these supplies across the state. So we're going to link up the libraries with their local area agency on aging or county council and make sure everyone gets connected. And they will be the ones supplying the libraries with these. And what we're asking is if they can be displayed for whatever time period the libraries feel like is appropriate, and we can move them across the state. Each partner only has 1 to 2 of these, depending on the area. So they're going to move them around. We won't be able to get one in every library at the same time. But for example, did you say somebody's on the call from Forsyth? So in that case, the main office is actually Glendive, but she has people in Miles City and Glasgow, and they'll get this to you. And
Heather and Forsyth already said, "Oh, I'd really like one of these." I really can't imagine a library that wouldn't like to at least have one of these up for, a month or a couple months, and then maybe offer some. And you said you provide the materials, the bookmarks and stuff, and maybe get a local member from their regional office to come and do maybe a program or a talk, a brown bag lunch talk, something like that.
That would be great if we could also set that up in conjunction with the time period that this is on display. And I know, let me go in here really quick to my email, because I know that, let's see, Amelia, there we go. So
Yes, so Amelia, Kim is our lifelong learning librarian at the State Library. She started in June, and health literacy is going to be her primary focus, developing programming and resources for libraries related to health literacy. And that's how Amelia connected up with Renee and put her in touch with me to do this webinar. And Amelia has also been collecting resources online at the State Library's website. So this is, if you'll just scroll up a little bit, Renee, I just want to point out that if you go to the State Library's webpage and click on Services to Libraries and Library Learning, basically you can get to this page. So that's how you navigate to it, the learning portal at the State Library website.
Yeah, and so it talks a little bit about what we're calling the mobile kiosk and the hardboard, basically. And to access that, I have talked to half of or not all of my partners are aware of this, but I was able to, in Billings last week, we were at a regional meeting and give them their supplies, and then we're going to meet with the rest of the state at a recertification in a couple of weeks. So not everybody has all of their supplies yet, but I will be giving all of them the list that Kim has supplied me with the contacts for all the libraries, so they'll have that. And then I want to make sure any of you in the libraries also can access your local place, and you can always contact me, and my information's there as well as on this call. But let me just get you to so we also have our webpage, MissoulaAgingServices.org, and Senior Medicare Patrol is one of our pages here. It's thinking. And then from here, I also have all the partners here listed. So this has all of the areas. And if you're not sure which area,
there's Glendive right at the top for Heather in Forsyth. So
yeah, exactly. And And
Shoot her an
so,
email.
in fact, I see I got to change Jody's name there. But we definitely want everybody linked up locally. But again, I am a resource here as well if folks want to contact me directly, and I can link you up there. And part of the reason is we have the supplies all across the state instead of just coming out of Missoula. And so our website here, we also have materials that people can access, and we're going to unveil. They're not live yet, but you'll be sent these MSN videos. We made 4 in a series. They follow a nice storyline, and we were going to show them on this call, but there's a lot of lag time in them. And so when this is over, those will be made available, and they will also be put up on this site as well, so people can access them. And that's another thing, that if libraries can have those available in the library, they'll be on YouTube during the time that we have this mobile kiosk going around. That would be a great thing as well. And they can also be shown, like if you want to put on an event, they could be shown to people as the presentation itself.
How
It basically
how
walks
long
you through
how long
what.
are each of those videos? I
Oh,
mean, what's the
they're
length?
somewhere between 2 and 3 minutes each. So
Okay,
I think the
sure.
total run time for all of them is around 12 minutes if you watch all of them together. And the story is like, what is SMP? What's an MSN, the Medicare Summary Notice? Kind of goes through solving a quick fix, like calling a provider, and then the call to action, how to volunteer, or if people want to volunteer. And I used 2 of my volunteers they're the actors in the video series, and it just kind of follows them along. Instead of a how-to, like this is what it is, you really just listen to these 2 talking and going through. It's almost like you're just a fly on the wall in Nancy's kitchen. So we kind of tried to make them something that people wouldn't mind watching. I know there's a lot of how-to videos out there and stuff, and we wanted to kind of make more of an enjoyable, like just following a story. So that'll be something we get out to everyone as well.
So
And
I think one of the questions that will likely come up as librarians participate in this little project and is, so if someone walks into their library with a form and they're like, I'm being billed for things that didn't happen, if there's something on there that they notice that they're concerned about, that they think could be fraud, your materials explain who to call and what to do about that?
yes, they just need to call SMP, and we can help them with that.
Oh, okay.
Yeah,
So
so we
you
actually
put your volunteers in action then.
yes, I have 5 here in Missoula that do cases.
Uh-huh.
That you don't have to have a medical background, but we happen to have like a retired medical coding specialist, a retired nurse, and but people don't have to have medical backgrounds to volunteer. The training is all provided by SMP. It's, again, because of the national project, we have a national resource center, much like you are, Joanne, to
Uh-huh.
libraries. We have a resource library ourselves, or a resource center, I should say. I'll go to this is the main site for nationally SMPs, and they would, find us if people clicked here. But there's all sorts of resources and links here, and maybe we'll put, this link to this website as well on the state library page.
Yeah, that's
Um,
a great idea.
yeah, and it's resources for SMPs right here. We actually have all the training and the foundations training. People can go through and do this on their own if they wanted, but it just talks about, again, SMP, Medicare basics, fraud and abuse, and common scams. And that's another thing that we do, and I didn't mention, is we are also actively always trying to head scams off before they can take hold in Montana. So, like for instance, today I was on a call, and I understand in Arkansas they're getting slews of calls of people purporting to be Social Security and telling people their number has been blackballed apparently until they give information or something, and people fall for scams all the time because these con artists are so good at what they do and how they use psychology against us. So that's another thing we do. We put out PSAs. We do, short interviews on TV or radio if we can, and get the message out there ahead of time. If we hear of a scam, so if you guys are ever aware of something that's coming into our state, like you're hearing from people or you're aware of it, and you let me know, we can get information out there through our network to try and warn people.
Both the Attorney General's office and the Office for Insurance and Securities, the secretary there, both of them are actively working to prevent scams, especially against seniors. It seems to be a real target audience, and we have such an aging population here in Montana that that really impacts our state very, very negatively. So that's real important work too. And we recently did a financial literacy day, and we spent quite a bit of time talking about seniors and scams. They weren't all necessarily not related to Medicare. I mean, actually, I think the one you mentioned about Social Security is one that they're really worried about. And they've got terrible, awful stories that they can tell about people who've had their bank accounts or retirement funds cleaned out by scammers from overseas, and there's not much that really can be done to recover that funding. So anytime, and I know our libraries have been, when they're aware of things, they have the opportunity to kind of head that off before something really tragic happens. So it's very important work.
Yeah, and so I'm glad that I'm able to share this information with the libraries, because you guys definitely see a lot of people in person. So here's a flyer we created to try and help spread this word that Medicare is, mailing the new cards. We're slated to be wave 6, and there's only 7 waves. So with this being the new cards coming out between April of this year and April of next year, my thought is that we're not going to see the new cards hitting like in the mass mailing until somewhere around the beginning of 2019. But they're not letting people know ahead of time. They're just saying, everybody's going to get them sometime after June. They've moved the date to, and so now they are doing these in waves. So Illinois is getting theirs, other states, but Montana's not slated yet until wave 6, whatever that will mean. So we're trying to tell people that the cards are going to be mailed as long as your address is correct on file with Social Security. It's no longer going to have a Social Security number. That's going to be a non-intelligent number. So these type of things, if libraries ever want to, just have something like this out on a table or, posted, we would gladly supply you with these as well, or when we get things like this. So that's another way that maybe we could partner, and that would be something if I'll let my partners know when they are contacting libraries to make that connection and offer it. And if folks want to take advantage of that, they sure can. And that would help, again, get the messages out to people more than we are.
Most libraries do have a public information board somewhere, usually in the lobby of the library or near the circulation desk, so everybody gets to see it. And so I think that would be they're a good place to put flyers up like this, and it's great to just at the same time let the librarians know that this is an opportunity for fraudsters to take advantage of our seniors. So be talking to people about it and inform yourself so that you can help others, because they're always in a good position to do that.
Perfect. Well, I'm sure we make it all available.
Great.
I think that's about everything I wanted to go over today. Just, an overview of the program, the what's to come. So from here, what I'd like is all of my partners, once they get all of the materials, some of them, like I said, have them. So I'm going to send out the list of libraries to my partners today, and that way they can start contacting you all and making that connection. But you guys don't need to wait. If you would like to contact them, you can definitely do that. They're either at all the area agencies on aging, except in Bozeman, they're at the HRDC office. And
Okay.
again, would it be easy, Joanne, that I send you the list of partners and you can email them to everyone as well?
I think the best thing would be to send it to Amelia because she's doing the updates
Perfect.
on the webpage. She couldn't be with us today because of another meeting she was committed to, but she'll, send it to Amelia. She'll get that page updated. I'm also just curious if maybe one of those hardboards might be available in Billings for our fall workshops conference. It would be nice to just sort of set one up at our registration desk so people can see it. And I'll follow up with you on that, Renee.
Yes, I will connect you.
And thank you so much for thinking about libraries and for getting right out of the chute and organizing this little partnership. I think it's a really great start, and hopefully we'll be doing lots more stuff in the future together.
Yeah, well, I appreciate it.
All right, I'm going to go ahead and stop our recording now. And if you are listening to the recording, you are eligible for half credit for viewing this video. Just be sure to look for the CE credit online at the library directory Aspen CE tracker, and just search by date, and you'll be able to find it. So it's August 14th. It's the date that this video was recorded. Thanks for watching.